Welcome to UCLA Extension's webcast series on professional certificates. Today we are discussing patient advocacy. I'm your host, Celia Sudri, joined here by Lori Viveros, Program Manager and creator of the UCLA Avon Cares for Life program through the UCLA Johnson Cancer Center, Marcia Colon, System Director in charge of care coordination and clinical social work at UCLA Health System, and Sheila King, Program Director in the Humanities and Sciences Department at UCLA Extension. Our online and on-site patient advocacy certificate covers a wide range of topics and essential skills and knowledge, including the fundamentals of the U.S. healthcare system, the role of patient advocates in a variety of healthcare settings, cultural competencies, care planning, grievance and complaint management, and much more. So let's talk about patient advocacy and the growing need for this new type of healthcare professional. Okay, now Sheila, you helped to develop the certificate. Can you tell us a bit about why it was created?
Yes, UCLA Extension created this certificate in response to the growing demand for patient advocates to help people navigate the complex healthcare system. In terms of numbers, we've got a perfect storm brewing, where we've got millions of baby boomers who are already accessing the system in terms of services for older adults. And we've also got uninsured people who are going to be accessing the system when the Affordable Care Act is enacted. And so we really felt the timing was right for this certificate, and we really want to help give a broad, strong foundation for these patient advocates to be able to function in the new jobs that are going to be coming up. We also have created the program so that they can take it online or they can take it face-to-face. In the online format, they'll be able to take it from the convenience of their home or their workplace, and if they're taking it face-to-face, they can come to the UCLA campus and have more of a traditional classroom setting. So we're hoping that by providing this variety of formats, we really will meet the needs of all our learners in the patient advocacy certificate.
Fantastic. And just to get a look at, the day-to-day life of a patient advocate, Lori and Marcia, can you kind of chime in on how that looks and, any specific examples you can think of day-to-day?
Well, I think there's a wide variety of activities that a patient advocate can engage in, some of which include empowerment, care coordination, case management, really working one-on-one with families and patients to get optimum care. I know I had one example of working with a patient who was unfortunately diagnosed with stage 4 breast cancer, and her husband was with her at every visit, and just you could tell, was really affected by this news and sort of how this was going to change their lives and what it meant for them as a couple. And he was really having a difficult time sort of organizing himself and not getting flustered at every doctor's visits. And in turn, that would then upset the patient, and she would become flustered. And so I was able to go in, meet with the patient, build rapport, and really help them get organized, take a deep breath, and just let's see what services we can have put in place for you. And let's take a little bit out of the calm the storm, as it were, and let's work together step by step to get to a place where we can get her to treatment, get her the services she needs as far as support, and support for the husband as well, the caregiver.
Okay, great.
Another example is when patients and families in the healthcare setting, particularly when they're hospitalized, they are undergoing enormous stress from either the illness, the diagnosis, or some traumatic situation that brought them there. And so it's very frequent that we see that they become distressed regarding the process that how the care is being delivered. They might become angry, impatient. They want to talk with the caregiver, the physician, or others of the team. And when all of that doesn't flow in their minds like they would like it to, they become agitated. And that's when a patient advocate is needed. And so the patient advocate is called to really help temper the situation and help the patient and family identify what the issue is and see how we can resolve it and make it a win-win for the healthcare team and the patient and family.
Okay, great. Thank you. Now, can you explain to me what the Hospital Consumer Assessment of Healthcare Provider System, or HCAPS, survey is?
Well, the HCAP's questions
Okay.
have to do with how satisfied a patient is regarding their care while they've been treated, hospitalized generally. And so HCAPS now is evolving into a process where if the hospital doesn't get a certain standard of scores, that there will be a financial penalty of sorts. And it all has to do with some new structures regarding what Medicare and Medicaid expect hospitals to achieve in terms of these satisfaction scores. And when we don't achieve it, then they're beginning to, and I think it came into effect, or October 1, if I recall, of 2012, they're going to start retracting some dollars from payment.
And Marcia, how has this affected your day-to-day work in terms of working with the healthcare team and with the patients in terms of their patient satisfaction?
Well, I think we're all very aware of how important patient satisfaction is. Particular hospitals have very specific programs related to constantly improving patient satisfaction. And so where I work at UCLA, we take patient satisfaction very seriously. We even do administrative rounds several times a month to go and meet patients and ask, how could we improve their care? And so it informs us in terms of what processes need improvement, because every hospital healthcare system, inpatient or out, can improve and should improve. So I would say a heightened awareness of responding to patients and families in an immediate sense and not waiting for too much time to pass.
And I think that's really important as, UCLA to kind of be at the forefront of taking that initiative and being proactive
Yes.
and making it very much a patient-centered
Yes.
model of
Yes.
care. So
Yeah.
absolutely, that's
Good
great.
point.
Could I ask you, Marcia, you're going to be developing the conflict and crisis management
Yes.
course.
Yes.
And how do you see that course preparing patient advocates for the work that they're going to be facing?
Well, I hope it prepares them 100%. When there is a conflict with a patient or family, the healthcare team is moving in many different directions, and we need a designated person like the patient advocate to come in and take the time and sort out what the conflict is. So what my class is going to do is go through week by week, identifying the nature and origin of conflict and crisis, how to respond, what family dynamics are that contribute to conflict and crisis. And the whole focus of my class is to really think through and be aware in terms of before you respond. You can't go into a room without understanding the context and respond too quickly. You have to get the lay of the land and be very informed before you start responding.
Okay, great. Now, patient advocates wear many hats. Where can they work? I mean, can they work in the hospital setting and private care?
It was really exciting when we began creating this certificate because I didn't realize that patient advocates work in so many different areas. Patient advocates can work in the hospital, like Marcia does, like Lori does. They can work at healthcare clinics, community clinics. They can work even in research. They can advocate for people who are on research protocols with new medications or new protocols for cancer treatment. And they can also work in government settings where they can advocate to help change the laws. And our certificate has been built and designed in order to help people get a broad base of knowledge, including ethics and important foundational communication skills, so that they can function in all the different settings and choose which area meets their needs. And we hope to prepare them for a variety of different roles.
And Sheila, I just wanted to also add that I think we're going to see the emergence of private practitioners, patient advocates, working with patients and families. We have the baby boomer situation, the Affordable Care Act that is going to be emerging in 2014. And these patients and families are really, they want a coach, they want an advocate, they want someone who can help walk them through the ambiguity of a healthcare system and all of the decisions that they have to make. So I think there's going to be significant opportunity for this role to expand and develop.
We also understand that they're going to be working in many states are going to be developing healthcare exchanges to meet the needs of the uninsured who are trying to figure out what insurance policies they want to get. So I know that there will be an expanding role for advocates in that area. And our curriculum will be addressing that because we will be talking about insurance and Medicare and Medicaid throughout the curriculum.
Okay, great. Now, on the day-to-day level, how do patient advocates work with a healthcare team?
It's a very collaborative approach. We work, obviously, patients at the center, and we work closely with folks like social workers, child life specialists, the physicians, the nurses, the medical team to really understand from the patient's perspective what the needs and concerns are, and then work together as a team to strategize and put together a plan that's going to then be able to assist the patient.
An example of that would be when a patient advocate would get a referral, she or he would come up to the floor, and before they would go in the patient's room, they really would need to converse and consult with the team members. Why is the referral being made? What do they expect me to do? And they want to gather as much information as possible before they start talking with the patient and family. Wouldn't you agree?
Absolutely, and I think there's different models to that, particularly in the program that I work in. We're part of the care. So when a person is diagnosed with breast cancer, we know ahead of time for that particular clinic who it is that we need to meet with, talk with, and we are given the introduction by the surgeon in our case. You know, as part, we can be either a part of the clinical visit, or we can come in after the doctor has examined the patient and speak to them about what exactly are the next steps moving forward. And so I think that there's all kinds of models where it could be a referral process or a process where you start at the point of a diagnosis, and as an advocate being part of the medical center, you can go in and speak to the patient.
Okay, great.
May I ask both of you, if you have a difficult situation where perhaps the patient is complaining about the physician or the nursing care, how do you handle that kind of delicate information sharing with the team and then circle back to the patient?
I think that one approach that I have used, because we are a teaching hospital, we do ask, and we will talk to the attending to see if there is an opportunity to see a different physician at the next visit, or if there's a particular complaint or concern about that physician who saw the patient. We can also work with the nurse supervisor to discuss any concerns and see how can we work together to help support the nursing staff who's overwhelmed, you know, underappreciated, and try to figure out a way to make the clinic a little bit more of a welcoming environment. We've done things where we've worked with a patient who actually wanted to file a complaint and just let them know about the resources. So although we are employed by the hospital and in the cancer center, we do also have to balance that with the patient's rights and experience, and be able to then make sure that their voice is heard.
Yeah, I think that's great. I would add to that, when the patient and family is complaining about a provider, there probably is an underlying process or meaning that's occurring. And the patient advocate really wants to get to that underlying meaning so that we can begin to solve it. And many patients are fearful of making the provider angry or upset, or they will then disengage from their care. And so it behooves all of us, and certainly as we think about improving care, to help the patient express their feelings, get them out so that we can clear the air, communicate to the respective providers, and make things better. And it ends up oftentimes being a win-win. But we don't want patients to harbor feelings, and sometimes they have misinformation, and it's easily correctable as well.
Absolutely.
Okay, great. Now, advocates work with patients on a variety of levels, as you have stated. How do they help with specialty care?
Well, with specialty care, there's been a lot of work, particularly in cancer. We have a program for breast cancer patients out at All of You, and we've been actually very successful with showing increase in adherence rates to treatment. So before our program started, we had 75% of our patients, which is still not bad, completing their treatment. And after our program, we were able to reach 97%.
Wow.
We were also able to reduce time from biopsies from 53 biopsies to the initiation of treatment from 53 days to 35 days, and been able to really improve adherence to quality indicators, national quality indicators, from I believe 69% to 86% post-program implementation. And so moving forward, I think that there's going to be a lot of patient navigation, patient advocacy work done, particularly in cancer. I know that the American College of Surgeons and their cancer committee is now looking at the role of patient advocacy and patient navigation in their accreditation process. And so particularly in specialty care, I think that there's a lot of movement in this particular field.
I would also add that what we see in the ICUs, that is certainly specialty care, is that many of these patients have been in the ICU for a long time. Their families are very fatigued. Sometimes things have gone very well, sometimes things have not gone so well for many different factors, and I think it's a very important role for patient advocates. The other area is when the patient is declining and we can really see that the patient is terminal. That level of specialty care is very critical, because we want the patient advocate to be in that situation and helping the family really process the grief and the stages of grief, particularly if they're thinking about withdrawing care. That brings it to a whole different level. And the patient advocate comes in with their knowledge, skills, and experience and compassion, and can really help bring the family together with the team and try to make the best decision possible for the patient.
Okay, great. Thank you. And now, Lori, you're teaching a class currently for the certificate. And I'm sure that you're seeing a lot of career changers. Can you kind of tell us who this industry is right for, like coming from different backgrounds?
Absolutely. So there's currently in my class, there's a varied backgrounds. Folks who have maybe some background in public health, communications, psychology, and also just life experience. Maybe taking care of an older, an aging parent, or taking care of a child with special needs. Coming in with that experience and really seeing this as a calling, that's definitely something that is going to make them successful in this particular career. It can also be very challenging, and I think that that's one of the things that is important to acknowledge, is that the healthcare system is very big and complicated, and
messy.
Yes, it's not sort of clear cut always, and so being able to build that resiliency, to overcome those barriers, work side by side by the patient, and really engaging them. It's a wonderful opportunity to be able to be part of a patient experience at one of the moments where it's most vulnerable for them. And what a gift, and really to be able to see the difference that you make in their lives is amazing. And it's work of the heart. It's really something that you can be passionate about, very dedicated, and you just have to remember to take care of yourself first. It's that great analogy of being on the airplane. You always want to put your oxygen mask first before helping others, and I think that's a very important point in this work.
Lori, in the class you're teaching, how are you going about talking to the students about taking care of themselves? I know I've read your curriculum, and you have some things on sleep, nutrition, exercise,
Absolutely.
mindfulness, and stress management.
Absolutely. And putting together, one of my goals for that particular class is to put together a care plan for yourself, to really put some thoughtful, put in some thought behind what that would look like, what relaxes, each student, what is something that they can engage in to really decompress. And at the end of the day, when maybe a patient you've been working with for 4 years had just passed, when you go home, what is the first thing that you would like to do? And for some folks, it's a variety of different things: guided imagery, yoga, taking a run, for even if it's for 10 minutes, and so and really allowing them the opportunity within that course to brainstorm and think about what are some care plan activities that you can put in place ahead of time, so that you've already thought about these things. When you go home. One of the other examples is putting together a gratitude journal, because I think sometimes in this work it can get lost in some of the challenges, and so I think it's important to just be mindful about that and jot down some things that you are grateful for, that you do get to do, today, and what is it that you're able to do as far as making a difference in a patient's life.
I really like the way that you've incorporated it into one of the first classes that the students will be taking in the curriculum, because they're going to start getting a practice of doing that from the very beginning, and really understand how important it is to carry through not only the curriculum but through their career.
Right,
It's
absolutely.
very exciting.
And it's probably overlooked in a lot of people's
And
careers.
it is. I think it's easy when you're passionate about the work that you do. I think it's easy to lose yourself in it, and
Right.
so you need to remember to take a step back, go outside, take a quick walk, rejuvenate, recharge, and then you're ready to go
Yeah,
again.
exactly.
Thank you. Now, we've heard a lot about, the job and the day-to-day, and I want to hear more about the certificate. And can you tell us, some of the benefits of the program and what it prepares you for?
Well, the program will give students a very strong basis. So they go over the fundamentals of the U.S. healthcare system, so they're going to get to know what Medicare is, what Medicaid is, what insurance plans can offer to patients, and to help them, even if it's just with the basics, or resources of how to answer the questions that they have surrounding the healthcare system and their providers, and what insurance covers and what it doesn't cover. We also have this introductory course that Lori is teaching that is an overview course. It will help students really gain a broad knowledge of what patient advocacy is. Cultural competency, I know, is a really important component of that course. And then they also will get training in ethics, conflict and crisis management, which Marcia is going to be developing and teaching. They will be getting on financial aspects, they will be getting some very strong background in the financial aspects of the healthcare system. So again, they will be able to identify resources and provide information to their patients. And they also will be looking at healthcare law. So what is HIPAA? Why is it so important? Privacy for patients. And they will be looking at liability and all the important information that surrounds healthcare law. So we think it's a very comprehensive, we think it's quite unique, and we think it's going to prepare students for all of the basics. And it ends with a capstone course where we really will very much focus on care planning and putting together all the pieces so that they can actually work on case studies and present these case studies as evidence of their learning in the curriculum.
Great. Sheila, Marcia, Lori, you've shared some wonderful insights today with us on the exciting career of a patient advocate. Really appreciate you taking the time with us. And thank you to all who were watching today. Please visit us at uclaextension.edu/patientadv for more information. Thanks.